Ventilator-associated pneumonia. Introduction to ventilator-associated pneumonia. Ventilator-associated pneumonia (VAP) is a significant and potentially life-threatening complication that occurs in patients who require mechanical ventilation. It is defined as pneumonia that develops within 48 to 72 hours after endotracheal intubation. VAP not only prolongs hospital stays and increases healthcare costs but also poses a significant burden on patients, leading to increased morbidity and mortality rates. This article aims to provide a comprehensive overview of VAP, including its risk factors, clinical presentation and diagnosis, prevention strategies, treatment options, complications, prognosis, and future directions in research. Understanding the various aspects of VAP is crucial for healthcare providers in effectively managing and reducing the incidence of this nosocomial infection. 1. Introduction to ventilator-associated pneumonia definition and background. VAP is an infection that occurs in people who are on mechanical ventilation for an extended period of time. Basically, when you're hooked up to a machine that helps you breathe, there's a risk of nasty bacteria making its way into your lungs and causing trouble. Prevalence and impact. VAP may not be as famous as some other types of infections, but it's a common problem in hospitals around the world. Studies have shown that it affects around 10 to 20% of patients who require mechanical ventilation. That's a pretty significant chunk. And as you can imagine, dealing with VAP is no walk in the park. It can lead to longer hospital stays, increased healthcare costs, and sadly, even higher mortality rates. So, yeah, VAP is definitely not something to be taken lightly. 2 risk factors for ventilator-associated pneumonia. That's why having certain underlying conditions, like a weakened immune system or chronic lung disease, can increase your risk of developing VAP. Patient-related factors. Factors like advanced age, smoking, and malnutrition can make you more susceptible to VAP. So, if you're a silver fox who enjoys the occasional cigarette and maybe doesn't eat the healthiest diet, you might want to pay extra attention to those ventilator hygiene tips coming up. Intubation and mechanical ventilation factors. The joys of being intubated and hooked up to a machine. While mechanical ventilation is a life-saving intervention, it also comes with some downsides. Being intubated for a long period of time, having the tube repositioned frequently, and not properly managing the ventilator settings can all increase your chances of developing VAP. So, it's not just the bacteria you have to worry about, but also the way the tubes and ventilator are being handled. It's like a game of avoid the complications. 3. Clinical presentation and diagnosis of ventilator-associated pneumonia. Signs and symptoms. So, how do you know if you've got VAP? Well, the symptoms can vary, but common signs include fever, cough, chest pain, and difficulty breathing. Diagnostic criteria. Doctors aren't just mind readers, unfortunately. They rely on specific criteria to diagnose VAP. Some of these criteria include a new or progressive infiltrate on chest X-ray, along with signs of infection like increased white blood cell count or purulent respiratory secretions. Basically, they need some concrete evidence before they can say, yup, it's VAP. Get this person some antibiotics. Imaging and laboratory findings. If you're really unlucky, you might need some extra tests to confirm the diagnosis. Imaging studies like chest CT scans or bronchoscopy can help take a closer look at what's going on inside your lungs. And let's not forget about the lab work. Culturing the respiratory secretions can help identify the specific bacteria causing the infection. Thanks for watching.